because with no, well, first of all the schools were closed, the children are already out of school, but some kind of education was provided, either online, either the teachers would send papers to the children to prepare and then to send back to the school, it depended on the level. But if there were no adult responsible for this, the children by him or herself would not be able to go to school and to register and to get the papers and everything. Of course, child marriage, for girls especially, this is a very big issue. Brazil is the fourth, Brazil is the fourth country in the world with number of girls under 18 that are married or living in a marital status. Child labor, because if the responsible for taking care, bringing food to the family was dead, maybe usually the older brother would step out to do that. And sometimes it would be a boy or a girl of 14, 15, they would have to take care of the other younger brothers and sisters. And other kinds of exploitation, child labor, sexual and other kind of exploitations. Because without a parenting, without a care, right, an adult to care for them, children would be exposed to all kind of exploitation. So the strategies that we developed was we had to analyze, to identify who were those children. I analyzed the death certificates in Brazil. They have to register if the dead person left younger, underage heritage, daughters and sons. So we had to look over around 4,000, 3,000 death certificates, and so we identified 460 children who lost their parents. The number is bigger if we count the children who lost the and grant priority to first labor programs that we have. Okay, just 5 minutes on. Here we go. So then the second challenge was ensure food security and basic living conditions to these children. So the strategies were, we had a municipal law passed to improve a cash transfer benefit to those families, to the family who would get a child, an orphan child. And then now we are in progress of implementing a municipal law, a municipal plan to tackle all the challenges that we have. like domestic, and now not only for orphanhood from COVID, but from other situations also, like domestic violence, the women that were killed by men, either her husband or her partner, or because of domestic violence, and that they left children also, usually very young children. Policial and urban violence, that it's a very big issue in Brazil, and other natural causes. So this is also in progress, and also discussion with public lawyers to give priority to child custody programs and procedures, and training responsibles for child protection services to identify any heritage or benefit that the child might have from their parents, that they are very young to know about it. So, like the mother, usually the mother can have less like a house, and there's somebody in the family that's living in the house, but the house legally belongs to the child, but the child doesn't know that. So we had to be sure that everything that was left for the child is used by them, or at least are their products, like if it's as a rental or something, it's in the benefits of the child. And the third challenge is the mental health issues. We have to learn how to see when the child is in mourning, and how to overcome that. In school, they can get either violent, either how can I say, not learning, not wanting to go to school, can be depressed, we have a lot of things that the child can go to alcoholism or drugs in a later age. And this is all because of the sadness that comes from the loss of the parent and the situation, to feel abandoned, to feel without any care in the world, right? And then grant the right for the memory of the parents, especially if the child is very young and went to a foster family or to some other family. They have to know that there was a parent, there was a mother, that there was a disease that killed a lot of people and everything. So we are in progress of training those responsible for child protection services, especially teachers in school. Otherwise, they will always criminalize some behavior of the child, that it's not a crime, it's a sadness, it's something mentally, psychological response to this mourning that he or he is going on. I think my time is over, and I had a lot of other things, but this presentation will be granted for everybody, because then there's all the data that we collect, and then what we are doing with that. This is still in progress, and this is a situation that it's in the whole world. We estimate that more than 1 million children are in this situation in the whole world for just one disease. No, it's like the AIDS when we had. But most people that died from AIDS didn't have children. But most of the people who died from COVID left children. I thank you so much for this opportunity, and then we'll be here. If you have any questions, I can help. Thank you so much.
Thank you. Thank you very much for the presentations. More louds of applause, please. More louds of applause as we wait for the next presenter. Our next presenter this morning is the presentation is on vacuum technology. And the presenter is Deepak Raj. is an executive director of Karuna Foundation, Nepal, and a honorary counsel of the Netherlands to Nepal. Is a distinguished advocate for the child welfare and inclusive development. I'll just invite him so that he starts. So please welcome, and please can we appreciate him as he walks to the podium. Thank you.
Good morning and namaste everybody. This is Deepak Sabkota from Nepal. My pleasure to be here, and I'm very pleased to be together with Yoko-san from UNICEF, who is my friend during our study together with Andrea and many. So let me get into the topic, that is children and technology, and specifically children with disability. So I'm talking a little bit. So let's have a look on this drawing. This is made by one of the child with disability in remote village of Nepal. What this tell us? This was a little bit developed by our communication experts. In the first picture, the child was born. The family was very happy. Both the parents were very happy. But after 2 years, it was known that the child has a Down syndrome. And he started to go here and there, falling down, running, and the parents has to go to the farm. So what they did, they dig a hole in the ground, little bit deeper than his size, and put him there all the day. Every year he got little taller, the hole become little deeper. The joy becomes in a way a burden to the family. Who is responsible for that? What to do? I think yesterday I was in Kibera, the slum, and then I visited a couple of centers where they are providing therapy to children with disability, cerebral palsy, Down syndrome, many more. The situation is more or less same everywhere. I think a little bit about definition. It differs from country to country, culture to culture, context to context. In some culture, violence towards children is a little bit taming. They want to tame a child so that he or she can be a good grown-up, responsible citizen. Correcting life lessons. Sometimes they say it's a Western idea. It comes from West towards Africa, towards Asia, and maybe Latinos. What else? I think how your society in Africa sees these issues, the culture, the tradition, the practice that we have, how it is taken here, is also very important. We know there are lots of, I think everybody, all of us here, we know the different forms or types of violences. That's very common, but one new is coming, and that is technology related. We have to start thinking already how we are going to deal with the violence that is coming through technology, coming with technology in the modern society. I think in Africa and also in Asia, including Nepal, there are lots of enabling environments to deal with this issue. There is a convention, international commitments, to name few, CRC and its optional protocols, CRPD and its optional protocols, and many other instruments that has been agreed, signed by the state parties. There must be national legal frames. There are legal frames, and you know what is here for Kenya and for Africa. What I feel after being here for a couple of days, it's very progressive. And one beautiful thing in terms of disability that I have been experiencing in my country and beyond Nepal is disability. The issue of disability is pretty neutral, impartial. I think no political leaders will disagree to provide support and care and other measures to deal with disability. So we have to be a little proactive from this point of view, as this is also enabling environment that we do have to deal with disability. I think the biggest challenge, which was discussed yesterday and day before here in this hall, but also in Nepal, is the status of implementation. Government signs agreements, they do all the commitment, there are legal frameworks, there are good plans, we have been contributing to formulate the plans, but what is the big lacking? Implementation, allocation of resources, expertise. So these are the challenges that we have to overcome. Let's get into the point, technology. Can we live without technology in this modern era? Is it good or bad? What do we think? In any case, whether we think it's good or bad, whether we think, whatever we think, technology is going to be one of our integral part of living. We cannot live without technology. It's coming more powerfully, more and more. In a very short period of time, maybe in coming 5 years, there will be such a revolution in technology that we even cannot imagine today. And that may bring us to the next level. Are we ready for that? It will be an unprecedented revolution in the area of technology and innovation. I'm pretty sure it will not take more than 10 years to come that stage. Are we ready for that? Then the million-dollar question is how it can help to deal with violence against children. Couple of strengths or opportunity that can be used. We greatly, these technologies we can greatly useful to reach the underage into no time. You do not need to travel there by days and days and days and fly. With technology, you can reach there. Identification can be done easily with the help of application. Case reporting. If something is happening, one guy can put in a Twitter or in any application that can come to Nairobi in a second. You can take actions. And then interventions. We can provide interventions through online also. In case of disability, assistive technologies for children and adults with disability, with all types of disabilities, it's making our life way, way, way easier. Education, there are lots of applications that can help children with all types of disabilities to study, to have academic excellence. Life skills, communications, transportations, and so many. I think you know many of them. So it's blessing. Research-related activities, it has helped a lot in terms of researches. Online jobs, though it's not maybe related to the children, but many people with disabilities, youth with disabilities are using online platform, the wheelchair users, to many jobs like outsourcing and so many other activities. It's not necessary to be there physically, facing all the difficulties and challenges in the street. Then caregivers. When we talk about disability, caregivers are key. The family members are key. Can you imagine a mother of that stage taking care of that child all the day, helping household activities and so on? Technology has helped a lot. There are lots of other assistive devices, wheelchairs, and many more with lots of sophistication that can help a lot. And then one world, I think a child from Nairobi, from Kathmandu, from Sao Paulo, or New York, they are all equally smart and equipped to use the iPhone 15 or 16 or whatever technology emerges in a second. That has helped a lot to unite us as a human being. Some gaps. Child pornography and online abuses are very common. I was taking a picture with the big group of children this morning, and a kind lady came to me and she came to ask me how you are going to use this picture of my children. I think quite a strong and quite relevant question. And then, so this is happening. Guidelines using technologies, it's emerging, so there are not much clear guidelines and protocols to use technologies. Access to information, right or wrong, whatever. There is information, a lot of information online portals and all these kind of things. So, and it's huge. How they use it, how they process the information that is available free of cost in the tips of their finger is key. Then isolation. I don't know what is the situation here, but in my country, even the couple sitting next to each other in the couch, in the living room, using their mobile and having less and less and less physical contact, social life. And virtual reality versus reality, like you can live in virtual reality, but that is not reality of your life. So how you can make a balance? We need to come up with some solutions. So after talking all these issues in relation to technology, children and protection, and children with disabilities, let me use this opportunity to tell something about Karuna, the work that we have been doing. This is a disability lifeline that we have developed in Nepal, which is being replicated in Congo, in Tanzania, in Bangladesh, in Sri Lanka, and in some other countries. It begins from child wish. When a couple would like to have a baby, we have to be well prepared, like whether the mother is ready for this or not. So this is the flow of disability lifelines. We can talk later on during the discussion session on that. Then I have two short videos, how we operate in Nepal in terms of reaching to the children with disabilities. Sound. No, that's the other one.
In Nepal, many families are unable to take good care of a disabled family member. They don't know where and how they can be supported and often hide them in their homes. Our community-based rehabilitation facilitators, CBRF, locate the paralyzed children. We inform parents that their living conditions can be improved with proper treatment and support. In a locally organized disability assessment camp, we're able to diagnose the disabled person. The CBRF, together with the parents, develops a rehabilitation goal and plan for treatment. We provide physiotherapy, a wheelchair, and train and guide his family to give physiotherapy exercises. We encourage the parents to join a self-help group and start an income-generating activity. The family is now proudly taking good care of her child with a disability.
So there is one more short video that shows you how Nepal looks like, little bit. So thank you very much. This is the end of my presentation. I think we will have more time to interact if there are any concerns during the session and later on. Thank you very much for coming early in this morning.
Just be seated, please. Okay, thank you. Can we give more rounds of applause? And during that time, I would request that we are joined in stage by our first presenter, Andrea. Please, let's continue appreciating our presenters. Please, let's continue as they settle down so that we have them seated. And we have very few minutes so that we can take on your questions and maybe observations. Only if you can pick one from this row, one from this row, and one from the other row. Kindly, who is ready? Yes, please. Can we have the mic there?
Yeah, thank you very much. My name is Salome. I have a question for Karuna Foundation. You said that you did support the government, which took ownership of the program. So I just wanted to understand what kind of support you did provide to the government. Thank you.
Yeah, thank you so much for the great presentations. My name is Alice. This question goes to Andrea. I wanted to understand whether that program that you're running on COVID was entirely run by the government, or did you also have partners coming in to support?
Mine is not a question, but I just needed clarification on the previous slide before the video, kindly.
Good morning. My name is Priscilla Wahome. I'm a child protection consultant. My question goes to Karuna. This is something very interesting for me. I don't know if I missed out part of the presentation because I just walked in, but I wanted to find out, do you think there are any ways that technology firms can adopt or can make their platforms more inclusive for children with disability? Thank you.
Yeah, I think we'll just start. I think we could start with Andrea, please.
Yeah, since it's just one. Well, and as a prosecutor, I only deal with the government. My job is to be sure that the government implements the public policies towards these things. And then if the government wants to have partners with NGOs or, I don't know,
and I would like to request you all also to follow, is the exit plan of any program. It cannot be continued for age. So in case of Corona, we have very clear policy that in 3 years we exit. Whether it fails, whether it succeeds, we completely exit from that place by handing over the responsibility to the municipalities. In case of Nepal, municipalities are very powerful, autonomous to implement the activities. And from the day first, we have an agreement with provincial government and municipalities that they take responsibility of implementation. They share the cost 1/3 by
if the couple, once they plan to have a baby, and then start to take folic acid, 400 microgram folic acid, both the couples, husband and wife or the partners, and continues unless the lady conceives a baby, and the lady continues for 3 more months, then the chance of having a child with neurotube defects, which are hydrocephalus, spina bifida, cleft feet and palate, cleft lip and palate, and cleft foot, and many more, can be decreased by 90%. And the cost of 1 folic acid tablet is around 1 Nepalese rupees, which is maybe a cent of dollar cent. It's amazing, And then cerebral palsy. If the deliveries are taken properly, if there are no prolonged deliveries, chance of having a baby with cerebral palsy goes down. So every mother should be in hospital or under the care of medical, persons, during deliveries. There has to be pregnancy planning, but also planning of deliveries in a very proper manner. And then once the child is born, there are lots of issues of hearing, lots of issues of this retinopathy of prematurity. They say you can examine whether a newly born baby can see or not, can hear or not, congenital heart disease and developmental delays in the little bit later phases. So all these can be prevented, or at least the burden can be reduced significantly if we pay attention in the very early stage. And then once the child is born and start to go to school, I think one very simple method that we have applied in Nepal is school health screening every year to see how the child, the status of the vision of the child, status of the hearing of the child, and growth monitoring according to his or her age, the height and weight. These 3 simple things can tell you how the child is going to be developed in coming days, And then the whole program is there. I think there are lots of information in the webpage of Karuna. If you are interested, you can go through it. We can help you to provide more information. Thank you.
Thank you very much. Yes, Sam, had something to say?
So Karuna is, the meaning of Karuna, Andrea, tell me what is Karuna? The meaning of Karuna is compassionate action. Action with compassion.
I just had something very burning for Andrea. Andrea, every time you work with a prosecutor, we often see them as very hard people who don't have emotions. You seem to be a social worker prosecutor. What's your secret? What makes you do that?
Thank you for this question. Well, the prosecutor's office in Brazil has a different system. We have the criminal prosecutors that do the criminal cases, but also and then we have a juvenile system. There are specialized judges and prosecutors just for children's rights, and then we have those criminal cases and those civil cases, unindexed civil cases. So yes, we have to have we have to be, we say that we have very few civil rights, children's rights prosecutors. We say that we are like ETs, because we are very different apart from the other things. And we have to do that this way, because we have to see children as a person in development, in the process of development, and the rights bearers. And this is very difficult to see because it's a world that was always dominated by adults, and so we have to give places for the children. But this is more of the system, it's our system that works like that. Of course, that everybody that works in that is how can I say, is taken by this other way to see the human nature, to see humanity, to see children, and to develop their rights. It's a rights-based system. We're not doing that for how can I say, it's not a gift, it's not something that we are to do to the children. No, we want to grant them their rights. That's what we're doing. We're not giving charity. We are not doing assistantialism. No, it's rights. It's a rights base. And if a child has a right, somebody has yes, and that's the government. So that the government has the duty to implement those rights, and I'm in the middle to see that the government is doing their part. That's all it is. Thank you for the question.
Thank you very much. We'll still appreciate our presenters as they walk out of this auditorium. Please, kindly, we welcome you again to make presentations. And we are grateful. If there are any things that require consultation, please, you can consult them. They are still here with us. Two announcements. Please, if you are the owner of this vehicle, KCC 239S, if you are the owner of the vehicle number KCC 239S, can you please can you attend to someone at the entrance or attend to your vehicle? Then the next announcement is that we are moving to the next session, and we'll use the next few minutes to transition to that session. So the first request is that the presenters from Save the Children, kindly can you liaise with the IT team? Okay. So the next thing is that we are now guided by the programs that we have, and we have in this seminar hall the presentation from Save the Children. We have also Mtoto News at Hall 2, and we also have SVRI and the AICS presenting in Hall 3. Please, kindly, can we save on time and get to our respective halls? We have noted there's not much transition time. Kindly, we save on time. Yes, it's okay. Tea is also at 10:30. Then you break out for you head to the breakout in rooms after tea. So we meet here at 2 for the closing ceremony and call to actions. Thank you. Okay. Again, as we walk out, there are things which are lost and found. If you left your items in the main hall yesterday, please contact Mary Munyao at the Secretariat. She will guide. Please, if you lost or you left items in the main
hall yesterday, please contact Mary Nyunyao at the Secretariat. She will guide. So Save the Children, please, can you take up this auditorium? Thank you.
As they try to finish with the ICT desk,